Hi, everybody. Thank you so much for tuning into today's session and sharing a bit of your Friday morning with us. I'm really excited to kick off our program on the first ever statewide survey focused on the experience of LGBTQIA midlife and older adults in California. And as many of you know, the Golden State is in the midst of a really remarkable demographic transformation. In just the next 5 years, California will be home to over 10 million adults age 60 and older. And among them are thousands of LGBTQIA individuals whose unique experiences and needs and strengths have often been overlooked in data, policy, and service design. But the survey at the center stage of today's conversation takes a critical first step in changing that dynamic. With input from over 4,000 people across the state, it gives us a much clearer picture of both the challenges as well as the incredible resilience in this community. So the survey explores a number of dimensions from healthcare access to financial stability, mental health, social connection, and safety. And it offers recommendations for how we can better support LGBTQIA Californians. And this is all part of a broader effort to make sure that our systems are ready for an aging population and that everyone is included in that vision. So with that, it's my pleasure to turn it over to Ross Lallian, Chief of Research at the California Department of Aging's Division of Policy, Research, and Equity. We call it DPRE for short. So Ross, I think at this point, I'll turn it over to you.
Thank you, Maria. Good morning, everyone. Thank you so much for being here this morning. I'm Ross Lallian, the Chief of Research with the California Department of Aging. Kathleen, David, and I are thrilled to be here today and share results from our survey from challenges to resilience. And we're also grateful to have Jax Kelly with us here today for the panel discussion. And Jax was an instrumental member of the stakeholder advisory group, which we're going to speak to during the presentation today, played a critical role. And we're going to tag team the presentation. We'll kind of bounce back and forth with the slides. I think the game plan for today, we'll start off with some presentation slides. Then we have a panel discussion and hopefully some time for Q&A at the end there. So with that, I think before we begin, I'm going to hand it over to my panel members for a quick introduction, and then we'll go through the slides. So Kathleen, I see you next to my screen. I'll hand it over to you.
Great. Thank you, Ross. My name is Kathleen Sullivan. During the time of the study, I was the executive director of a nonprofit called Open House, and I have since moved back to Oregon, but still very involved in the work that's going on. I've worked with LGBTQ older adults for over 20 years, creating programs and services, and it's just a pleasure to be here today. And I think I will pass it now to David Lindeman from UC Berkeley Citrus.
Thank you, Kathleen, and thank you, Ross. And we really appreciate the opportunity for presenting today. David Lindeman, I'm Executive Director for Citrus Health, our Center for Information Technology Research, but in this case was able to coordinate our wonderful colleagues both in the private sector and across the UC system to put together this program. And our program works on bringing technology innovation to practice, and particularly with older adults, family caregivers, and providers. Thank you. We're looking forward to today's program.
Thanks, David. Thanks, Kathleen. Jax, I'm hand it over to you for a quick intro, and then we'll get into the slides.
Hi, I'm Jax Kelly from Palm Springs. I'm the founder, president, and executive director of a group called the Aging and HIV Institute. And as Ross was mentioning, I was playing a big role with this as president of Let's Kick Ass Palm Springs as well, a small not-for-profit in the Coachella Valley that helps people who are aging with HIV.
Thank you, Jax. Appreciate it. And so before we get into the slides, I just want to recognize the folks that made this survey possible. It's my fellow panel members, Kathleen, David, Marcy Adelman from Open House, and also Director Susan DeMorris from the Department of Aging. They deserve to be recognized because they really made this survey happen. It was just a concept. It was an idea. It was a conversation, right? And they brought it to life through dedication and recognizing how important collecting these data are. I'm thinking about the timing of this survey. These data are more important than ever before, right? All the recent changes of rhetoric were kind of the midst of these data are even more valuable now. And I think future iterations of this type of survey will be even more valuable. So shout out to everyone who made this survey possible. I'm going to go through the slides now. So I want us to start off with some context, right? I think Maria said it well. Many of you have probably heard about these demographic shifts that the state's experiencing. Older adults are comprising a larger share of the state population. Just a few years, 2030, it's estimated that about a quarter of our state population will be over 60 years of age. In the Williams Institute out of UCLA, they estimate that about 5.5% of adults in the U.S. identify as a member of the LGBTQ community. And so we don't have an exact number of older adults who identify as a member of the LGBT community in California. However, we know it's a substantial number. It's a significant number of Californians. But however, we know little about their health and well-being. What we do know suggests that there are significant health disparities. Without data, it's hard for us to address those health disparities, quantify those, and actually develop solutions for those health disparities. So to qualify to take this survey, one had to be at least 50 years of age, a part of the LGBTQ community, and also resided in California. And the community we surveyed, they've been through a lot of trauma over the decades, right? The discrimination, the hate, the violence that older members of the LGBTQ community have endured over the years is frankly heartbreaking. It's something that can't be erased. And this really underscores why it's important to collect these data and really understand the needs of the community, current and future health and well-being. And this is essentially why we pursued this data collection effort. This is the first statewide survey of midlife and older Californians who are part of the LGBTQ community. And we describe their survey as a baseline because it's the first of its kind survey, and we hope to build upon this data collection effort. We hope that this really marks the beginning of a more focused, kind of consistent look at the needs of this underserved population. This is the beginning of this effort. That's really exciting. So we don't have all the answers today, but this is a great starting point for us to build on. And as we learned over the past few months, service needs can change quickly. So it's very important to continue this data collection effort. So this survey also aligns with the goals of the state's master plan for aging, and I'll discuss that in more detail later in the presentation. We received over 4,000 responses to the survey, which we're thrilled about. We had responses from every census region in California. And the survey respondents were generally more white, higher income, more educated, more urban. And so we conducted what's known as a convenience sample, which is a common sampling method. And essentially, this method doesn't require a random selection of participants based on any type of criteria like demographic factors. So it's probably not going to be a representative sample because we're not applying those criteria. I just want to mention that because I think while we're happy with the number of responses, this information is valuable. This survey was a major success, I would say. It's important context that has to be mentioned as we discuss survey results. And it's also an important factor as we look towards future surveys. So the survey team, a project of the scopes, takes a team effort, and I'm really grateful that I was able to work with a very talented, dedicated team who actually made this effort into a success. The Department of Aging, we worked with Open House, the Citrus team from UC Berkeley, UCSF, and Berkeley Center for Advanced Study of Aging Services. So David, Kathleen, and I will describe each organization's role in the study. But also want to recognize the California Aging and Disability Research Partnership. We at CDA work closely with the research partnership on a variety of efforts. And this is a collection of talented folks from throughout academia, the nonprofit space, who are subject matter experts on a variety of different topics impacting older adults. And they provided valuable guidance throughout the survey process. I just want to give a little shout out to CADR, as we call it. So CDA's role, so we provided funding for the study, and Director Susan DeMora, she was a champion for the study. I think her leadership on this effort was invaluable. She did a great job along with all of our study partners on communicating the importance of this study to a variety of stakeholders and media, and I think that really helped with our survey response numbers. And I think we played a valuable role in supporting our partners as appropriate, kind of being the state lead on this effort. We're fortunate to work closely with the team on each step of the process, so survey design, data analysis, reporting, et cetera. And our hope is that CDA's role signals that the state government really takes these issues seriously. We're here to support all older adults, and equity remains the cornerstone for us. And we remain committed to addressing equity gaps. So we hope this can be a model for other states, local governments, and we're here to help our colleagues throughout the state and country who are doing this type of important work. And I think a critical role currently for us at CDA and all study partners is getting these data out there, right? Doing these types of presentations because we don't want this report to sit on some shelf. That's not why we collected these data. So I think with that, I'm going to hand it over to Kathleen, who's going to describe Open House's role in the study. So take it away, Kathleen.
Thank you, Ross. Kathleen again, Kathleen Sullivan. And Open House, along with Citrus, really brought this idea to the state. And I'm happy to say the state immediately embraced the concept of doing a statewide study. Open House itself was founded just over 25 years ago by Marcy Edelman and Jeanette Kverch. And initially, it was to provide affordable and market rate housing and services to LGBTQ San Franciscans. But as we started, we realized one, that affordable housing takes a long time to build, and there were service needs and program needs that LGBTQ seniors had in San Francisco and around the state. And so Open House really expanded its portfolio to provide training for providers of care and services, particularly in the city of San Francisco. We were um, contracted with the city to provide training on how to collect SOGI data and the importance of that. And SOGI is data on sexual orientation and gender identity. In terms of the survey itself, Open House was really the recruiter and the connector to the LGBTQ plus community in the state of California. So we recruited the advisory committee. Jupiter Peraza on staff was really instrumental in that, and then also helped to develop the statewide coalition that helped to bring the survey to the community, but also gave feedback to the survey itself. And now I'm not sure if Ross, if I pass it over to David, perhaps?
David, yeah, I think yep, David's next. Thank you.
Perfect. And thank you, Kathleen. And before I talk about the other members of this coalition, I really want to go back and reinforce the initial leadership that brought this to bear. I not only thank the Department on Aging and our directors, Susan DeMorris, but Ross, who saw this opportunity and brought this to fruition and brought us all together. And of course, Kathleen and Marcy Edelman, who envisioned this and saw the need for California to be in the lead in this area. Without their combined efforts, we would not have been able to do this. And what it did allow us for was to bring together a unique coalition of organizations and use our state public university system the way I think it should be used, to work together to push key issues forward, do cutting edge research, strong evidence-based information to help make policy. So we're in a very unique position at the Center for Information Technology Research in the Interest of Society. We try to do translational work, and we do it actually quite well, major impacts. But in this case, being able to bring together very quickly colleagues across our UC system. And in this case, we were able to, if you go to the next slide, bring in our colleagues particularly at UC San Francisco from the Center for Sexual and Gender Minority Health, who are national experts in this area. And under Anissa and her team, we were able to put together an amazing group for both methodology and folks to conduct the initial survey overall. And it brought us to the point where you'll hear all the results today, their implications and strategies going forward. But quite an amazing professional group. And if you go to the next slide, what we were fortunately able to do in addition to that was work with our colleague, Dr. Angie Perrone, who runs the Center for Aging and Advanced Study of Aging Services, to complement the work of the survey with funding from several philanthropic organizations, several foundations here in California, who also believe in the need for getting more information and addressing these issues. So again, a great combination, more to come as Angie's results from her focus group work with very hard to reach individuals, really looking at in depth on some of these issues that will be coming forward shortly. So we look forward to sharing even more of that. And one final point, I want to make sure that people understand, we'll get back to this in our discussion at the end. This year, I'm fortunate to serve as the chair of our Commission on Aging. And one of our key focus areas with our Commissioner, Marcy Edelman, is to move this forward. But the most exciting news that we can share today is that just within the last month, a new Senate Select Committee on LGBTQ has been formed under Senator Laird, who has been a champion in this area. So we already already see mechanisms to have hearings and move this information forward. So as we get to the end of the presentation, we'll look forward to talking with you about how we can take this information that's been that is so profoundly informative and make sure we move it into society and have a really change policy. And now I'll turn it back to Kathleen to get us into the heart of the program.
Great. Thank you, David. So well said. So why was this survey important? I think maybe some of you know why or have an inkling. But just for context, California was always on the cutting edge in terms of policy initiatives that support LGBTQ plus older adults, particularly around training, around the LGBTQ plus resident Bill of Rights in long-term care communities. Many states, including the state that I'm in now, Oregon, really look to California for new and innovative ways to create policy and programs that would support this uniquely underserved community. One thing that California had not done, however, was really get that baseline data on the aging experience of LGBTQ plus Californians. And with the Master Plan on Aging having as its third goal inclusion, not isolation, we thought that this was an opportunity for us to actually come together and talk about creating a baseline study. And this would really help us to have a better understanding, despite the fact of what Ross said is true. We can't generalize from this because it is snowball or convenience sampling. The baseline data is really a foundation that we can use, and Dr. Perrone is already using as a way to dig in deeper on issues that affect this community and really just have an idea of where or what the starting point is on how the LGBTQ plus community ages and interacts with the service community. So we can go to the next slide. Thank you. So how did we do this? And Jax is here and can talk about his experience after the presentation, but we thought first and foremost, and this is coming from Dr. Edelman as well as from Open House, that we needed to ground the study in the community. And to do that, we felt it was very important, despite our great colleagues at UCSF having an enormous amount of background studying LGBTQ plus issues, that we wanted to have an advisory group that would actually partner with the research team to go over literally every single question that was going to be asked, and also to look at the translations. We translated the survey into both Chinese and Spanish and Tagalog, and then obviously offered also in English. And so the community and the advisory committee really helped us to ground the study in the community, ensure that the language that we were using was appropriate for those different language groups, and also provided real-time feedback to the research team. The other component was we thought we need to have a coalition statewide. The coalition will do a couple of things. One, tell us regionally if there are things that we should be focusing on in the survey, but then also were the people that were sort of the trusted voices in their own community. And they were able to leverage their local resources or local groups to really get more people to take the survey. One example is an organization called Centerlink, which many of you might not know about, but it is a national organization. And in California, it has over 50 LGBTQ plus organizations that are members. And so Centerlink was the first group that we went to really leverage the resource that they had, which are names of organizations of people who might be interested in being participants in the survey coalition group. So we can go to the next slide, and it explains a little bit more about the coalition and the importance. The advisory committee was made up of 10 to 12 members. Again, Jupiter Peraza at Open House did a wonderful job of really recruiting a very diverse membership group for the advisory committee to give feedback to the actual survey itself. And Jax can talk later about his role. He did an incredible job in Southern California, just getting the word out about the survey itself. The coalition is 60 members, or was 60 members strong. I think it's actually a little bit bigger now. And what we were doing was really using a model that was used in the Oregon study. So Oregon and Washington have done statewide studies, and we were coming in to do the California study and looking at the model that they had created. Oregon had a statewide coalition that met monthly. And, Oregon is a little bit smaller in terms of population. And so what we decided to do was sort of tweak that for California a little bit. And so we had regional coalition member meetings. So we did northern, southern, and central meetings, and then did statewide coalition meetings as well. And that group is an evergreen group that really allows us to learn what's going on locally in all these different regions of the state. But for the survey in particular, it was vital for us to be able to get the survey into as many hands as possible. So the coalition group really is responsible, along with the advisory group, to really ensure that we had those 4,000 members who were taking the survey itself. And I think for now, I am going to pass on or back to Ross.
Thank you, Kathleen, so much. Let's talk survey topics. So I would say this survey was a wide-ranging survey. It took about 20, 25 minutes, like 45 minutes to complete. And we worked with the stakeholder coalition, the advisory group, to really balance that time commitment. We don't want it to be too cumbersome, right? But that time commitment and also ensuring we included topics we found important. And that's kind of a hard balance, right? Because there's a lot of important stuff out there, but we don't want that survey to be too cumbersome. Think we landed on a really good space here. So these are the survey topics on the slide. It ranged from economic and social well-being, mental health, physical health, discrimination and safety was a really important topic. That was extremely insightful. Understanding access is important as we think about future policy. So those are the topics. Let's get into some of the nitty-gritty of the survey. So participants, as I mentioned early on, we had over 4,000 respondents to the survey, was spanned every census region in the state. We had a good distribution of age. I would say about one quarter were in that midlife range, 50 to 59. About 40% of respondents were 60 to 69. About a third were 70 or older. And most of the respondents were urban or were in urban or suburban settings, over 90%. So less representation from our rural communities. We kind of expected that because we met with a couple of other teams, as Kathleen mentioned, who have done similar surveys. They cited that challenge of getting more rural representation. I think there's an obvious challenge, right? There's less people who live in these communities, but also we heard that there might be some more hesitation to provide some of these data in a rural setting. Folks are, there's some degree of distrust potentially there. Nonetheless, the stakeholder coalition, open house, CDA, everyone, all the study partners, we did reach out to these communities. It was really important to us, but it was one of the challenges for us with the survey. In terms of race ethnicity, about 3/4 of respondents were white. The largest racial group outside of white respondents were Hispanic at 9%. We had similar representation from Black Californians, Asian or Pacific Islanders, and American Indian or Alaska Natives, and that ranged from about 4 to 6%. The majority of respondents also identified as cisgender, which means that these folks identified as the gender aligning with their sex assigned at birth. We also did get responses from gender expansive folks and transgender folks, which is extremely valuable. Just a quick note on representation as a whole. Again, we mentioned this a few times. This survey was extremely successful, but we in the state, we always strive to have a more representative sample on these types of surveys. But there's always challenges, right? It takes more resources, human resources, economic resources. That's going to be a challenge for us probably. But there's also still trust issues, as I mentioned, with those rural communities. That doesn't stop there. It spans other communities as well. And I think it's, based on based on folks' respective lived experiences, they have legitimate reasons to have that distrust, right? What are you going to do with my data? Why should I give it to you? So I think it's our job with the state government to continue to show folks what's in it for them, why it's important to complete these types of surveys, how it could be beneficial for them. And now that we have one survey completed, we have some data to share with folks and some tangible actions, hopefully. I think we're going to have a much more compelling story to share with potential survey respondents. So that's really exciting, kind of looking forward. And just want to share some overall findings. A really positive finding, I would say, is most survey respondents, about 86%, gave high ratings to their quality of life, while 14% rated their quality of life as fair or poor. So that was a really nice finding. But when we dig deeper into that 14%, we see that there's some intersectionality that I think is really important. This isn't a one big broad group. We can have a broad brush approach, right? There's intersectionality within the LGBTQ community. So, our survey data suggests that there might be some challenges that are greater for LGBTQ people of color, those who identify as transgender or gender expansive. And so I think future analysis is really important for us to kind of combine some different variables, do some cross tabulations to look at these data more kind of broadly, right? It's not this one, not everyone's going to have the same challenges. So with that, I think we get in some more details of the survey findings. And Kathleen, I think I handed back to you. Thank you.
Yeah. Yes, thank you, Ross. So there's lots of data, and I'm just going to give a plug for the CDA website that you can actually go to the website for the survey, and the data set is available to everyone, which is both incredibly impressive, but also was part of what we had discussed, that we wanted people to be able to interact with the data more. On a, and look at things that they were interested in. So we might not highlight everything here today, but I really encourage you to go to that data set because you'll be able to look at things that might be of interest to you and in the region of the state where you might be living. I think that when we're looking at mental health in particular, we've presumed that there are mental health struggles that because of discrimination, because of marginalization, perhaps because of internalized homophobia or transphobia, that this community would have high rates of mental health acuity, and then also perhaps have high rates of suicidation. And that really did bear out in the data. So you can see transgender women in the last year, from when the survey was taken, 18% had considered suicide and had considered it serious thoughts of suicide. That might speak to many things, and so we're needing to overlay the data. One issue that I looked at was rates of isolation, so feeling of isolation, and transgender women have very high rates of feelings of isolation. I think it was over 50, close to 50% feel isolated, and we know that isolation can lead to unfortunately, early onset of death. So isolation might be a component, but also just not having access to services. And we'll go over that in just a moment. I think the other thing is just to note that there's a lot of trauma in this community, trauma from providers, trauma from perhaps family of choice, not family of choice, I'm sorry, well, maybe family of choice, but blood relations not being welcomed or accepted in your family. You have to remember that the people that we were surveying, they were living when the APA declassified homosexuality as a personality disorder. And I used to always like to say that, a lot of our older adults were in their 30s, some in their 40s, when homosexuality was no longer considered a mental health disorder. And so there's layering of trauma throughout the lives of our older adults, and that is seen again in the data that we collected. So we can go to the next slide, please. Thank you. Also, we looked at economic well-being, and of course, this can be sliced and diced based on region, also based on sexual orientation, gender identity. But what we found is that there is a large number of people who report facing precarious financial futures. And, if you look at the supplemental poverty rate in the country for older adults, it's at 14%. So it does look like we have a higher rate of at least financial strain in this community potentially than the broader community in the state of California. We do say that, financial assistance counseling might be a service that would be needed for this group. Anecdotally, I know that from the work I've done in both in both Los Angeles and San Francisco, California, that financial counseling is something that LGBTQ plus older adults gravitate towards. Even for very low income people, just having someone come and help them work on a budget is usually it's helpful, but also gives them a sense of relief. So we'll look into the data more, but at this point, we are seeing a really high rate of financial stress for this community. And the next slide. Thank you. We know that social support services were reported as the #1 unmet need for LGBTQ plus Californians. that really talks to what perhaps people on this webinar are involved in. So increasingly, we see that despite the fact that we need services, services either are not being used or people feel like they're not really available to them. A number of people say that they don't have someone to turn to provide support. And that actually marries very well with an AARP study that was done several years ago, which showed, particularly in rural parts of the United States, that LGBTQ plus older adults don't have someone that they can get support from. What was also found in that study, and again, reflected back, is that a large number of our community members are providing support for another person. So whether that's family of choice, or if it's someone in their blood relation, we're giving an enormous amount of caregiving or living assistance to community members. And if we can go to the last slide, when I saw this slide that Ross put together from the data, I really said this is the most impactful slide I'd seen. It's the wow slide for me because it looks at recent experiences with unfair treatment, discrimination, or disrespect. And our transgender older adults, particularly women, are experiencing high rates of discrimination or disrespect. And that just puts more mistrust um, or an umbrella of mistrust over providers. I know that one older adult said he feels like sometimes when he goes into a provider, he feels like he's taking care of them when he discloses that he's a gay man, a gay older man, HIV positive, African American. And sometimes providers are startled, and then he feels like he has to take care of them and assure them that, everything is okay, that they're okay. Um, and so that level of distrust might also relate to people not participating in this survey itself. And that's why the Evergreen Coalition is going to be so important, because people will develop more and more trust with the survey. So perhaps in 5 years down the road, when we do this again, we'll actually see a greater number of Latino, Latina, Latinx, and African American older adults being participating. But I think this mistrust speaks to perhaps an area that we all can work on together in terms of creating safe spaces for LGBTQ plus older adults. And now I believe I'm switching over to or passing over to my colleague, David Lindeman.
Thank you, Kathleen, and thank you for that great summary and interpretation of what we learned, and and again for Ross and colleagues for distilling so much out of it. But the key issue here is actionable items now. Where do we move? How do we move forward? And as Kathleen nicely said, the key issue that we saw is the need for more services, specialized training, additional work to support our various communities that we are now being able to identify where those are. So we've identified and made recommendations, identified specific opportunities, and I'll go through not only services, but each of the areas Kathleen nicely covered to see what we anticipate are key action items, key opportunity areas. And again, this is not exhaustive, not meant to be saying these are a priority issue, but they're all very important and have been drawn from the data. So again, first and foremost, the idea that we just need more individuals, healthcare providers, first responders, caregivers, caseworkers, all working in this area with specific training, particularly with guidance and standards of care. We have wonderful service providers in the state of California, but we realize that there's a great deal more that can be offered. And particularly as you get into issues needing, with our cultural diversity, our language diversity in California, having specific training and background in that area. But we also have to include individuals in these service areas that come from the different population groups who can really represent and understand the dimensions of our older LGBTQ colleagues. And one final point in this immediate area is that we think it's very impactful to help support and build upon our existing service providers who need more resources, who need to be able to do even more in this challenging period. If you go to the next slide, uh, beyond the broader issue of services, we want to focus on a number of the key issues because this information is driven and these recommendations are driven by data. So we want to reinforce right from the beginning that we need to constantly have data to understand our population, look at trends, and look at ways that we can really understand where there are needs and gaps. And particularly if we can, we need to collect sexual orientation, gender identity data statewide. Most of our data sources do not provide that. And what we're looking for is a way to do that. And we also need to add metrics so that we're able to look at progress or lack of progress in this area. So a key issue that we're recommending is building in ongoing data collection. If you go to the next slide. In addition, in specific, once you have data, we want to make sure that collectively we're accountable for moving things forward. It's not just state agencies, but it's the entire ecosystem in this area. So how do we tie in and get back with this information to the wonderful folks who participated in the survey, to the organizations that participated, and make sure that we get input and voices from the entire population? But we also want to make sure we measure outcomes and are able to use that. And our California Master Plan on Aging is a perfect mechanism for doing that as we look for progress in serving all older adults in California over the balance of the decade. If you go to the next slide, uh, there are very specific areas that jumped out in terms of some of the items that Kathleen brought out. First and foremost, just getting access to services. But beyond that, there are several very fundamental issues that are we think need immediate attention, particularly issues related to suicide prevention. If anything, we're in a more compelling period. Also, trauma-informed care for provider training, because as Kathleen nicely said, this has been historical. How do we train people to understand the dimensions and what has occurred in potentially in the lives of older LGBTQ residents of California over the years? And again, having just access to information about all the resources. It's quite disparate right now, not coordinated as it could be. And also with some of our new technology tools, we should be able to make information far more accessible and available and do it statewide as well as down to the individual locations. If you go to the next slide, we also underlying all this is clearly economic disparity. And as Kathleen said, we have many individuals who are at financial risk. So creating a support system, looking at financial services, everything from people who had been negatively impacted over the long term to trying to build on existing programs that can support the economic security of LGBTQIA older adults. Underlying a key issue, as many of us know or should know, is that housing is central to economic security. And with the older adults being the fastest growing group of unhoused, of individuals who are challenged on their housing resources, it's no different here. In fact, it could be greater, and we want to make sure that we look at these underlying economic support systems for everyone in the state, but particularly for folks who are at risk in the LGBTQIA community. Next slide. And then social well-being, because it's also getting that connectedness, being able to work with this amazing ecosystem we have that creates support systems and ability for organizations to bring individuals together in a very supportive environment and to train people in how to best do this and help organizations with supporting older adult LGBTQIA. Next slide. And finally, because this is still a societal issue that isn't going away, unfortunately, we need to anticipate how to support people, how to reduce discrimination, and make safe spaces and make our society safer for our fellow Californians. So particularly, we need to provide additional training on how to deal with abuse, how to deal with issues in terms of just being able to make people feel safe and secure in getting their health care, their mental health, being able to have first responders understand best interaction, and specifically trying to look at different ways to train organizations beyond the normal and traditional health ecosystem and how to make it be much more friendly and open to all Californians, in particular our LGBTQ community. And finally, working even further to develop support in mental health and social support system. All of these are important areas. They're all very large. They will require resources. But again, the data have told us very clearly that there are many ways and many places where all of these areas can be actionable and have great impact. So with that, I want to turn it back to Ross, who can share with us now how we look forward in this area.
Thank you so much, David. I'm going to go quickly because we only have 20 minutes left. I'm looking forward to the panel discussion. So this next slide here, this shows alignment of the survey with the state's master plan for aging, or the MPA. And the MPA includes five bold goals, and 4 of them are listed here on the right-hand side of this table. And the MPA is grounded in equity and lifting up all Californians. Collecting these data from this underserved community speaks to what the MPA is about. It's about being inclusive and understanding the needs of all Californians. Really happy to see this alignment because data helps us quantify these issues. And that's why it's so critical to understand the magnitude of these issues, and helps us tell our story because we need both quantitative data and qualitative data. Speaking of qualitative data, we're going to get these slides out to everyone. I'm just going to touch on this. These are stories from the actual community, kind of brings this story to life, right? And so these quotes can align with the MPA's 5 bold goals. And then the final slide we have is kind of looking forward. And so this slide lists our priorities going forward at a very high level. Policy development's absolutely critical as we move forward. And our hope is that these survey data can be an input in improving programs, potentially more cultural concordance with healthcare and social service providers, additional training of service providers, which will hopefully lead to approaches that are even more culturally responsive. The policy program development, that's paramount. And we're going to look for opportunities also to promote the survey and also disseminate findings. We appreciate the opportunity to present to you today, and we'll conduct further presentations as we continue to disseminate findings. We need to get this information out there. Data collection is something that we always talk about, and we're going to always continue to talk about it because it's critical. And from a state perspective, we'll continue to strive towards collecting consistent demographic data. Consistent SOGI data is a very important piece to that. As I mentioned earlier, it's important for us to get out and inform the community about what's in it for them to provide us with their perspectives. We also want to emphasize as we share findings that this survey needs to be replicated and conducted on an ongoing basis. I think that generally as we conduct future surveys, we're going to iterate, incorporate lessons learned, and my hope is that future products will be even more insightful. And also service needs, other important information is going to change over time. We mentioned that a few times this morning. So it's critical that we continue to collect these data, and we have an opportunity to share best practices and lessons learned with other states, local communities. And so with that, sorry to kind of rush through that, I'm going to hand it back to Maria. I'm looking forward to the panel discussion. Thank you all.
Thank you so much, Ross. That was such an incredible presentation, very informative. And I do want to invite Dr. Sullivan, Dr. Linderman, and Jax up to the stage to kind of talk a little bit more in depth on the topics that we've heard so far. I went ahead and prepared a couple of questions for each of you that really kind of piqued my curiosity. But I also want to recognize that we have many folks joining us today that may have their own questions. So for folks that are on with us, please feel free to use the chat and the Q&A to drop your questions, and we'll do our best to sort of weave them into the conversation as we go along. So Dr. Linderman, I had planned to actually start with you, and I had questions about key areas where further research might be needed to understand and address the challenges faced by our LGBTQIA community members. And I think you did a great job in the presentation talking a little bit about the need to expand SOGI data collection and the need for ongoing data collection to be able to kind of track progress over time. And I want to kind of be responsive to a couple of questions that have come in already. One was, are there plans to disaggregate data for specific subsets of the population, for example, Asian Californians? And I think there's also a question in the chat, which I'm pulling up, about whether this project worked with REALM, or the Rural LGBTQIA Survey, and if it did kind of pull from or correspond to that survey, how was that relationship?
Sure, thank you, Mario. And again, those are all great questions. And I think fundamentally, as we started to share, there's a need to just make sure that we collect the SOGI data holistically in as many state surveys and programs as possible where they currently do not exist, or they just exist on a county by county basis or within a certain department. Also, making sure that data are there longitudinally so that we can have that over time. The one area that I did reinforce with our colleagues, with Dr. Peron's work, is the fact that even with 4,000 people, it was a snowball approach on survey work. We did break out certain groups, but we still had limited response from certain populations, particularly racial ethnic groups, and even with intensified outreach. And so, again, I think there's going to be a need to do deeper research there. Dr. Peron's group, doing specific focus groups, also looked at at some of those issues, particularly the rural population, going out and doing focus groups across the state and reaching smaller subsets of folks, particularly the transgender community. And that is a key issue because there's still fear of response. There's still issues of trying to reach individuals and making sure that we can be representative information. So that's still fundamental under this. In terms of the rural survey, I'll turn back to Kathleen because it was built more around the original work that was done in Oregon and our federal work from our colleagues at UCSF, but did not compare that survey data that I'm aware of so far. Kathleen may be able to comment on that. But I think, again, key issue going forward, how do we maintain this? Right now, there are no resources to continue much of this data collection.
Yeah, I will just say we did not work with Realm. Actually, it's interesting because there are lots of small surveys, and I understand Realm is a national survey, but there are an enormous number of people who want to learn more about the LGBTQIA plus community. We were very focused on California, so we did not work with them. The researchers that we worked with from UCSF, they were involved in the Pride study and had an enormous amount of background in doing survey data of the LGBTQ plus community. There aren't very many, however, surveys out there that really look at older adults. You may know that Karen Fredrickson Goldson, who's out of University of Washington School of Social Work, has really sort of created a real research team or research institute, the Goldson Institute, that's just looking at the aging of this community. And then Jason Flatt, Dr. Flatt, who is in Nevada now, was in California for a number of years. He's also done a lot of work. Dr. Jarman, I can't remember Jarman's last name off the top of my head, but there are a number of folks who have really focused, and that's what we wanted to do. And I saw someone asked about, I don't know if I should hand it over to you, but someone asked about the Inland Empire. I thought maybe Jax, you're the person who can answer that question.
With regards to the Inland Empire, that was it's kind of funny. I think in the state of California, oftentimes we think of parts of it as being rural as well. So, but it is a fourth largest population center in the state, and it was treated that way, I think. So, I'll let you move on with the questions.
Thank you so much. So clearly there's still a lot of work to do on data, and I just want to highlight that there are questions coming in that are specific to data collection and how to do this and how to build partnerships and build trust. I know that we're somewhat limited on time. I really want to hear from Jax next, and so Dr. Lindeman or Dr. Sullivan or Jax, even if you are open to responding to those questions in the chat, I certainly invite you to do that. But Mr. Kelly, I know that your life has spanned multiple eras of LGBTQIA history, from pre-Stonewall attitudes to marriage equality to now, where this community is again under threat. And I'm wondering if you can kind of share your perspective and reflections on what has that experience of aging as a queer person been? How has it evolved over time? And where do you see the biggest challenges today for this community?
Yeah, aging as a Black gay man with HIV has meant living through multiple eras of profound change, from pre-Stonewall invisibility and criminalization to the devastation of the AIDS epidemic to the hard-fought victories of marriage equality and legal protections. And despite this progress, the findings from this survey confirm that LGBTQIA plus older adults, particularly people of color, and transgender individuals, continue to face significant barriers to aging with dignity. And the biggest challenges that I see today include economic insecurity, where about 26% of respondents reported financial insecurity, with people of color and transgender respondents disproportionately affected. Many LGBTQIA plus elders have lower lifetime earnings due to workplace discrimination, and this impacts retirement security. Social isolation, 28% of respondents reported fair or poor satisfaction with social relationships. A key concern is many LGBTQIA plus older adults lack traditional family support structures and healthcare access. Nearly 1 in 5 LGBTQI plus older adults rated their mental health as fair or poor, and 11% reported serious thoughts of suicide in the past year. Meanwhile, HIV remains a key issue, with 17% of respondents living with HIV. And many continue to face stigma in healthcare settings, making affirming providers essential. The study reinforces what many of us already know. While we've made historic progress, our aging systems still fail to fully recognize and support LGBTQIA plus elders, leaving many vulnerable to financial strain, social isolation, and inadequate healthcare.
Thank you so much for sharing that, Jackson, for sharing that personal perspective, and great. Obviously, there's some really great alignment with what we're seeing from the survey results, and lots of additional work to do on data collection and getting a clear picture of what's happening and how we can support. But Dr. Sullivan, I'm wondering if I can bring you into the conversation, and I'm just curious, through your work, what successful models or best practices have you seen for creating inclusive aging services? And do you have thoughts about how we can scale these models statewide? How do we ensure that as we continue to make progress on the master plan for aging, that we do so in a way that addresses the challenges described in this survey?
Yeah, that's such a great question. And I think that, we're also in very interesting times because there's been a real push nationally against programs and studies like this. So we're in an interesting point in our history. I think when you're looking for models of how to include LGBTQIA older adults in either programs or to ensure that your services are really open and inclusive to all, you have to remember that this is a marathon, it's not a sprint, is what I like to say, that this is a long-term process. So the first thing I would suggest to people is just going back and doing the very simple thing of collecting SOGI data. So collecting sexual orientation and gender identity data on the people who are participating in your programming. Because what you might find out is there are more people who are participating from the community than you had known, or that perhaps you're not surveying the community, despite the fact that you might be in an area that has a vibrant LGBTQ plus community. So that is the first thing. You need to know where you are in terms of serving the community itself. You can do things like show up for events, be a presence in the community. You can also ensure that the materials that you use that really talk about the programs and policies that you have or services that you're providing include imagery of the LGBTQ plus community. I'll just tell a brief story. I was working with a local housing group, and it was a house matching group. So they would match women with women and men with men over the age of 60. Well, the community I was working with got the pamphlet and they were coming for a lecture, and it was standing room only because they thought, my community thought, oh, they're pairing gay men up with gay men and lesbians up with lesbians, and they had never seen themselves reflected in materials for that were targeting older adults. So we hardly ever see ourselves reflected in the marketing of an organization. So be cognizant of that. Be cognizant of what your intake forms look like. And then I think the most important thing is to really get trained. I know we say this all the time, but sometimes we don't understand the impact of our words, and language is one of our behaviors that we can change. So, there's a whole series of trainings around what do you do after a community member discloses their sexual orientation or gender identity to you. What do you say to them? You don't say things like, oh, that's okay, or it doesn't matter to me, because that's actually a negative. That's actually saying something negative to someone, and oftentimes just pulls them back and teaches that community member that you might not be the safest person, or that I'm going to be spending my time educating you rather than getting the service that I need. So get some training and then just keep an open mind. I just say stay curious. I think we should all be curious about aging in general, but also be curious about how you can provide programs and services to all of the constituents or all of the community members that you work with.
Thank you so much. And I'm just trying to keep up with the chat. There's a pretty robust discussion about whether people are more or less comfortable in disclosing LGBTQIA data now, given kind of what we're living in. So I just want to highlight that. But Dr. Sullivan, clearly hearing you, collect the data, show up, be inclusive, leverage training opportunities, and stay curious and open to learning new things. I think that's some really great advice. I want to turn to Jax, and I think I only have like two more questions. I know we're getting close to time, so we're going to try to fly through these. But Jax, I think we all know that many of our aging policies were designed with sort of a heteronormative framework. And from your perspective, what is it that needs to change to ensure that this community, that they're not just included, but they're prioritized in future policy development? And if you had sort of one piece of advice for younger LGBTQIA individuals about preparing for their future as older adults, what would that be?
Yeah. Well, first, the survey's findings make it clear that aging policy must shift from passive inclusion to intentional prioritization of LGBTQIA plus older adults. And that means targeting economic disparities. Over 1 in 4 respondents had less than $100,000 in total assets. And nearly 20% of transgender respondents reported an annual income of $20,000 or less. And policies must prioritize financial assistance, housing stability, and employment support tailored for LGBTQIA plus elders. Another is embedding LGBTQI plus competency in aging services. Many LGBTQIA plus elders avoid seeking essential services like mental health support and long-term care due to past discrimination. And 27% of respondents reported being treated unfairly or discriminated against in the past year. So requiring cultural competency training for service providers is critical. Expanding access to affirming healthcare and behavioral health services. 24% of respondents reported symptoms consistent with PTSD, highlighting the need for trauma-informed care. LGBTQIA plus elders living with HIV required specialized aging support, yet many aging services remain disconnected from HIV care systems. Cross-sector integration is essential. Improving data collection, as we've discussed, the report's findings are groundbreaking, but data gaps remain, particularly on the experiences of LGBTQIA plus people of color. And policymakers must mandate sexual orientation and gender identity, SOGI, data collection across all state funded aging services. The California's master plan for aging has made equity a priority, but for LGBTQIA plus elders to truly benefit, policies must be funded, implemented, and evaluated with their unique needs at the center. And when I was giving a piece of advice to young LGBTQIA plus persons today about their future as an older adult, this survey underscores a key reality. Aging while LGBTQIA plus often means navigating economic insecurity, social isolation, and healthcare disparities. So my advice is be proactive in building your own safety net. Plan financially, given that many LGBTQIA plus elders are working well past retirement age due to financial necessity. Younger people must start thinking about savings and retirement early. Cultivate your chosen family. 13% of respondents reported rarely or never receiving the emotional and social support they need, and 7% had no one to turn to for help. Advocate for policy change. While California is ahead in LGBTQ plus rights, 27% of respondents still reported discrimination in the past year, and the future depends on our ability to push for stronger intersectional policies that ensure we just don't just survive, but thrive as we age. So.
I appreciate that, Jackson. I know we're right at time, but I have one more question. I know if folks have to jump off, I totally understand, but I think this is a question that all of you may be able to respond to from a varying perspective. But just when I looked at registration, I know we have a number of local organizations and community members who signed up for today's session. And I'm just curious, could you share your thoughts about how they can engage and support state level efforts to support LGBTQIA older adults? And I think we've talked about it tangentially through some of the conversation, but I just want to, if there's an action item that you all can highlight to close us out, that would be really fantastic. Maybe we can start with David.
Well, I would just offer it starts at the local level, working, as Jack so beautifully said, within your area, as Kathleen has reinforced. But at the state level, it's being able to push for these issues, always call forward everything from data to services. And now with this opportunity with the Senate Select Committee that I put in the chat, that this will be an opportunity for us to have our voice and try to make sure these are called up, put into legislation, and given the visibility they need.
Jax or Kathleen, do you have anything to add?
I think the only thing I would add is that, we do things better together. So getting in touch with Jupiter Peraza at Open House and being part of the statewide coalition, because that's how we can all learn from one another is through talking and just having those avenues, but then also how we can learn and keep each other updated about what's happening at the state level. And there is a good opportunity with Senator Laird's new committee to learn and inform decision makers.
And before Jack
add something, I would just say that one of my favorite phrases is if you're not at the table, you're probably on the menu. So I would encourage people who feel that these issues are important to them to actually participate in advocating for them.
I appreciate that. One of my favorite sayings. David, I know that you're jumping in. Go ahead.
Just one final point, just how we first started, we have to call out the success of the California Department on Aging and their whole approach on this. And with the state master plan, it is given high priority. We're very fortunate to have leadership in that regard, and it's one that will help us stay focused on this even more so. Again, we want to thank them, and that's another wonderful way for everybody to continue to participate.
Well, thank you all so much for sharing your insights and sharing your time with us. Very robust discussion in the chat. That was really nice to see the engagement and connections being made. We will definitely be sharing the recording. We will definitely share the slides and make sure that you have the materials from the survey and the website link available to you. I would look for that next week. We'll try to get that prepped and out the door pretty quickly. And with that, I hope you enjoy the rest of your Friday and have a lovely weekend. And again, thank you very much.
Thank you.
Thank you.